Vaccine researchers say they are not skipping any safety steps when it comes to getting a coronavirus vaccine on the market quickly. Medical reporter Liz Bonus shares what goes into the testing and the trials.
Hey there, hello to you. The debate over when we might get a vaccine on the market and its safety continues today. Those conducting the trials say that they do expect, at least for the most vulnerable population, that there will be a safe, effective vaccine on the market within the next few months. How do they know this? Well, there is a rigid system in place for testing and trials, and already large populations have stepped up to participate and help verify it. One of those who recently volunteered to be part of the Moderna vaccine trial, Dr. Brett Casella. He got his first injection in phase 3 of the trial last week. He participated in the trial, he says, because as a physician, he's one of many committed to the science of research.
In my role, my current roles, I want great research that's really done right, done the right way with scientific validity.
He's not the only one. While there are debates about when a vaccine will be available,
if someone comes out and says, you know, I'm going to shoot for the possibility that I'll get it by October, you can't argue strongly against that. That's unlikely, not impossible. I think most of the people feel it's going to be November, December, but that does not mean that if there are a number of infections within a particular trial that allows you to make a decision sooner rather than later, it is conceivable that you could have it by October, though I don't think that that's likely.
There is no debate by those conducting vaccine trials that it will meet vigorous FDA criteria. The rush to market does not allow for skipping safety steps.
That's absolutely true. We are compressing steps and we are overlapping steps. And I think I've mentioned to you previously, you know, our collaborations with the FDA and other regulatory authorities, they are giving very thorough reviews, very comprehensive, very thoughtful. We've been on the phone with them at 9 o'clock in the evening. We've been on the phone with them on weekends. So they're really being Herculean in their efforts, but no shortcuts here. You know, you have to check all the boxes, as they say, and we wouldn't be doing anybody favors if we ultimately ended up with a vaccine out there that hadn't been thoroughly evaluated and know all the risk associated with it.
I don't know if I'm helping myself or not by getting the vaccine or a placebo, but I will get to an answer about whether this vaccine in particular works against COVID. If it does, great. We're one step closer to being back to normal life. And if it doesn't, then we can direct our attention to things that are going to work. We have to do this right and keep moving.
Now, one request from those who are conducting the trials is that you make an informed decision about getting the vaccine before you rule it in or out. For example, there will likely be more than one vaccine, and some might boost your own immunity. Others might help your body fight back by producing what's needed to protect against it. You can find out how the vaccine that you may be getting actually works to see if it's something you and your doctor feel is best for your own health. I'm medical reporter Liz Bonus. We'll throw it back to you.
Thank you, Liz. 3 large